Hello, my name is Hayden Loeb, and I'm a research assistant from the University of North Carolina at Chapel Hill. I'm a woman with long, dark brown hair, and I'm wearing a sweater that is striped blue and white. Today, I'm here to discuss my poster for the AIRP Research Day titled Addressing Barriers to Physical Activity for Adults with Autism and Other IDD with Community-Based Intervention. The other authors on this poster are Allison Marks, Elizabeth High, and Dr. Brian Tomaszewski. The study was funded by the NIH National Institute on Aging. This slide is an overview of the poster and the present study. There is a need to increase access to inclusive opportunities for physical activity for adults with intellectual disability, or ID. The Physical Activity and Community Empowerment, or PACE program, will be evaluated via clinical trial to address this gap. The present study demonstrates the efficacy of the measures to be used in the clinical trial for the target population of adults with ID. These next couple slides serve as an introduction to the poster content. First, it is important to note that about 40% of individuals with ID meet the diagnostic criteria for autism. So even though the PACE program is tailored specifically for adults with ID, its content is still relevant to autistic communities as well. Next, a little bit about why the PACE program was created and what challenges it aims to address. Adults with ID are more likely to develop dementia earlier in life compared to those without disabilities. And physical activity may delay the onset of dementia symptoms. To address this challenge, an inclusive, community-based exercise intervention called Step It Up was created that was shown to successfully increase step count and decrease body weight within its target population of adults with ID. Now, the PACE program is an adaptation of Step It Up that incorporates additional stakeholder feedback into its activities, hopefully creating an even better and more effective exercise intervention for adults with ID. This slide shows the measures that were used in the PACE program pilot study. This is a green table with two columns. The column on the left is titled Adult with ID, and the column on the right is titled Caregiver. In each of these columns, there's a list of the assessments that each group of people completed as part of the PACE program pilot study. The adults with ID that participated in the pilot study completed a body composition scan, a nonverbal IQ test, a quality of life questionnaire, the cognition and emotion batteries from the NIH toolbox, a series of physical activity assessments, and their physical activity data was collected by wearing an actigraph for at least 7 days. The actigraph is a physical activity tracker that measures activities such as step count and sleep, and it is worn on the wrist like a watch. The caregivers in this pilot study completed a series of assessments pertinent to the adult with ID that they care for. They completed the AdHealth survey, a measure of activities of daily living, a dementia screener, and an adaptive behavior assessment. This page shows some of the results of the PACE program pilot study. First, we found that a higher nonverbal IQ predicts a higher average step count with a p-value of 0.009. Higher nonverbal IQ also predicts better performance on strength and endurance exercises with a p-value of 0.03. Finally, a higher nonverbal IQ predicts better performance on mobility exercises with a p-value of 0.02. This slide summarizes the discussion section of the poster. Outcomes of the pilot study measures justify the inclusion of these measures in the clinical trial that will evaluate the PACE program for efficacy. In our clinical trial, we will include 376 stakeholders, including adults with ID, their caregivers, and exercise professionals and coaches from the local community. These are the discussion questions for the poster. The first question is, how does your research translate to impact the community? The PACE program will bring together those with and without ID, as well as other community members, in productive, healthy activities that will aim to decrease the risk of dementia. And if effective, the next goal is to replicate the PACE program in other communities outside of the communities of the study sites. The second question is, what successes and challenges are there in translating your research to impact the community? One success is that Step It Up, decrease the body weight and increase step count for adults with ID. One anticipated challenge that the PACE program will have will be the introduction of an interactive online dashboard that communicates each participant's actigraph data to them directly, and it may be challenging to implement this new online component in an effective way. If you are interested in learning more about the PACE program, please contact us at paceprogram@unc.edu. And this is one slide of our references, and this is another slide of our references. Finally, thank you for viewing this presentation.